Welcome everyone. This is Alveoly E-learning. My name is MK Obin. I'm one of your course instructors at Alveoly E-learning. The main purpose of Alveoly E-learning is to make learning simple and easier for all students, irrespective of where you are. All you have to do is to get access to a mobile phone, a computer or a laptop with an internet. Then you just sign up to www.alveoly.com. Okay, then you just get your pen and paper. When you log in, you have access to various courses. Then with the course that you have your interest in or you have difficulties in, then you sign up to those courses. Hello everyone. You are welcome once again to Alveoly E-learning. From our previous lesson, we looked at how edema is able to present itself or manifest itself. Then we made mention of localized edema and generalized edema. Then under localized edema, we made mention of ascites. And I said because they usually ask questions on ascites, so we have to delve deep into ascites. And we said ascites occurs when there's excessive accumulation of fluid in the abdomen. And because of the excessive accumulation of fluid in the abdomen, it makes it difficult for such patients to lie flat because it leads to respiratory distress. And because of that, a procedure is being done for them. And the name of that procedure is what? Paracentesis Abdominis. So today we are going to look into details on what paracentesis abdominis is and some of the nursing interventions that are important in the performance of what paracentesis abdominis, which is going to help us to answer questions in exams, especially anything around ascites in relation to paracentesis abdominis. All right. So the word para means half or just a small portion. The word synthesis means formation of fluid or accumulation of fluid. Okay. Then abdominis means what? Abdomen. So basically, the word paracentesis abdominis is defining what? The tapping. So it is the tapping of some part or a portion of fluid, to be specific, ascitic fluid, in the abdomen. So what usually occurs is that in paracentesis abdominis, you are not tapping all the fluid because that amount of fluid there is part of what? The total component of fluid in the body. So if you try to take everything out, the patient might go into hypotension. So to prevent that, you tap what? Just a portion or a small amount, depending on what the doctor or the amount that the doctor wants to be what? To be tapped. Okay. So basically, that is the definition of what paracentesis abdominis. It is the tapping of fluid from the peritoneal cavity, or is the tapping of what? Fluid, to be specific, what? Ascitic fluid. But it's just what? A part or a portion of the fluid that we are tapping. Okay. Now, let's look at some of the nursing interventions that you have to be very what? You have to be, or are very important, especially during exams. Okay. So first, as a nurse, you have to set what? Your trolley for paracentesis abdominis. So we'll give you the list of items and the things that you do, or the list of items that are needed on the trolley whilst the lesson is what's going on. Then one most important thing is that paracentesis abdominis is an invasive procedure. So paracentesis abdominis is what? It's an invasive procedure because you are going to introduce what? A needle to help you to tap the fluid from the abdomen. So because it's an invasive procedure, it is very, very important to explain the procedure to the patient and allow the patient to tell you what they are going to do for him or her. And as the patient understands, you reinforce in signing of what? The consent form. So here, consent form is very important. So for all invasive procedures, the most important thing here is what? Consent form. So as a nurse, it is your duty to explain procedure to patients and to reassure the signing of what? The consent form. Why? Because the procedure is what? An invasive procedure. Okay. And 2. We also explain procedure to patients to help allay patient fears and what? Anxiety. The patient might be having a lot of misconceptions or have not heard of what paracentesis abdominis is. In the course of explaining it to the patient, it is going to help the patient to understand whatever is going to go on. Then it will help the patient to become cooperative or accept in the performance of what? The procedure. So it's very important to explain procedure to patients in simple terms. Okay. One way of also allaying fears and anxiety is that you can introduce patient to someone who has undergone paracentesis abdominis successfully. When he sees someone who has undergone paracentesis abdominis procedure successfully and the person is doing very well, it will also encourage that patient to also do what? Undergo such a procedure. Then the next thing is that you have to allow patients to void before procedure is done. And this is a very important point, and they usually ask questions on this point as well. Why? Because per the location of the bladder, if the bladder is full, okay, and we are going to do paracentesis abdominis and we are not careful, there might be likelihood of what? Accidental puncturing of the bladder. So to prevent accidental puncturing of the bladder, you have to let the patient void or urinate or empty the urinary bladder so that we can prevent the cause of what? Accidental puncturing of what? The bladder. Then we have to check our vital signs. Okay, to be specific, the patient's what? Temperature, pulse, respiration, and especially the blood pressure. Because we said if there is what? An abrupt movement of the fluid from the abdomen, it can lead to hypotension. So we have to check our blood pressure to know our baseline data so that as the procedure is going on, we will be rechecking for us to see the difference in what? Blood pressure, so that the patient doesn't undergo hypotension. Okay.